Matrix, stiffness, and sarcoma grow, the scientific implication of compartments. Matrix stiffness of one of the main mechanical forces acting on cells is increasingly appreciated as an important mediator of cell behavior. It regulates cells signaling broadly, with effects on growth, survival, and motility. The stiffness of tissue has been used for centuries to detect tumors by simple manual palpation, either through the skin or directly on resected tissues. Solid tumors have generally been shown to be stiffer than healthy tissue. Enzyme binding to dentin requires the use of self-acting primers or acid-acting to decalcify, deserve, and expose a layer of collagen fibrils of the dentin matrix. Acid-acting reduces the stiffness of the mineralized dentin from approximately 19 GPa 1 MPa, requiring that it floats in water to prevent it from collapsing during bonding procedures.
Cancer is a group of over 100 diseases characterized by abnormal, uncontrolled cell growth. In a healthy body, cells grow, die, and are replaced in a very controlled way. Damage or change in the genetic material of cells by environmental or internal factors sometimes results in cells that do not die and continue to multiply until a mass of cancer cells or a tumor develops. Most cancer-related deaths are due to metastasis, malignant cells that penetrate into the circulatory system and establish colonies in other parts of the body. Great advancements have been made, but cancer is still the leading cause of death for people under the age of 85. In the United States, 1 in every 4 people die from cancer.
Cell proliferation and differentiation are often tightly linked processes and regulated by growth factors such as TGFB, Pavlov-derived growth factor, and fibroblast growth factor in mesenchymal stem cells. TGFB is particularly known as key regulator of EMT phenomenon and the associated tumor progression in multiple tumor types. In osteosarcoma, high level of TGFB correlate with grade and presence of metastasis.
Soft tissue sarcomas, the importance of proper biopsy and surgical excision technique. Soft tissue sarcomas are cancerous tumors that can grow in any region of the body, though they are most commonly found in the limbs and abdomen. They grow from certain tissues, such as muscles and tendons, fat, lymph nodes, blood vessels, and nerves. However, sarcomas are rare, while similarly appearing benign tumors are common, which is why many sarcomas are improperly surgically removed due to the incorrect assumption that the soft tissue tumor is benign. So it is important to have a soft tissue tumor biopsied by an orthopedic oncologist. The soft tissue sarcoma shown here is growing in the deep anterior compartment muscles of the thigh. If the tumor type is improperly diagnosed, an unplanned surgical excision or removal may be undertaken. This may result in several long-term negative consequences. First, the incision that is created using improper surgical technique often makes a large transverse skin defect. Secondly, when the soft tissue sarcoma tumor is removed, the tumor is often excised without a large enough tumor-free tissue margin, which will leave cancerous tumor cells behind in the body, leading to an increased chance of recurrence of the soft tissue sarcoma and requiring later removal of the contaminated tissue. The closure also leaves a large transverse scar on the thigh, often leading to unnecessary morbidity or disease and plastic surgery skin reconstruction. When an experienced orthopedic oncologist discovers what they believe is a soft tissue sarcoma, the surgeon will first decide which type of biopsy is best for the individual patient, an image-guided needle biopsy or an incisional surgical biopsy. Image-guided needle biopsy is a technique where the surgeon inserts a biopsy needle into the sarcoma with the aid of imaging technology, such as ultrasound, ensuring the needle is placed correctly. After, the sample is sent for pathological analysis, which will determine if it is a soft tissue sarcoma. Surgical incisional biopsy is a technique where the surgeon makes a small 3 to 4 centimeter longitudinal incision on the anterior or front of the thigh. Then the surgeon exposes the sarcoma and removes a small sample of the tumor. The sample is sent for pathological analysis, which will determine if it is a soft tissue sarcoma. The incision is then closed, leaving a very small indication of the biopsy. Several days after the surgical incisional biopsy, a diagnosis of the tumor will be finalized. If the diagnosis is positive, preoperative radiation therapy will most likely be ordered, after which the tumor will be surgically removed with a sufficient tumor-free margin, usually 1 to 2 centimeters of tissue around the tumor, so that recurrence of the soft tissue sarcoma is minimized. With the proper diagnosis and removal of a soft tissue sarcoma, the 5-year survival rate is very good for patients, 83% for localized tumors without metastasis or spreading. So it is important to handle soft tissue sarcomas in a manner that will enhance the patient's long-term prognosis.
As the tumor grows, the area around it undergoes a series of changes that largely depend on the nature of the tumor, and its analysis is important to understand the behavior of the lesions. The mesenchymal response is not specific and depends on the location of the lesion. In soft tissue, it will be a proliferation of fibrous tissues that surround the soft capsule, and bone it will be an osteoblastic reaction. Studies in common cancer of epithelial origin have been useful in the identification of candidate molecular pathways involved in metastasis and therapeutic resistance in sarcoma. However, the mesenchymal origin of sarcomas makes the unique and cellular process, like EMT and MET, cannot be discussed in the same manner as an epithelial tumors.